Okay, so we are back another week, and everything changes, it seems like, by the minute. So we try to get a grasp on things. And as you've been telling us now for over a month, we have to understand that if it's a model, if it's something that's being predicted down the line, everything can change based on human behavior. And there are a couple of things that have been clearly politicized and have gone back and forth. But just overall, before we look at a couple of points, overall where we are right now, how much has human behavior, social distancing, and listening to the rules, not necessarily by politicians, but by doctors like yourselves and other medical professionals, how much, now that we're a month and a half into being quarantined, have you seen at least something to say it can change or at least reinforce any predictive model down the line?
Well, for any kind of epidemic or pandemic, as we're seeing now, there is nothing better than to seclude the ones who are infected from those people who potentially are not infected. So the social distancing is a powerful method in terms of reducing infectivity, if it's number one adhered to, but also the problem is, as you could see, the longer it lasts, the more people get impatient. There's clearly a psychological impact that is associated with social distancing. On the other hand, it is, as I already mentioned, it is a very effective method in terms of reducing the infection spread. Um, you know, there are other things that need to be addressed, which are slowly happening, and that's the ability to test for infected individuals. That's number one. And number two, to be able to test those who have been infected and potentially have recovered to see if they have any antibodies. That's a little trickier. So, things can change very quickly. What we are seeing, though, is that the social distancing, as well as the reduction in any activity where there are people around, whether it be sports or anything of that sort, has reduced the number of people who present in hospital with acute disease, meaning the ones that don't stay home. That's been somewhat reduced in the areas of surge, such as the metropolitan New York area. Clearly, Pennsylvania now is another mild hotspot, but I think that that's also going to level off pretty quickly. And Boston, as we heard this week, is preparing for that. There are other areas in the country where people are preparing for these surges, which are not occurring to the level that they expected. So I think that we're seeing the fruits of this horrible methodology. But as mentioned to you earlier, in conversation outside this particular interview, is that there are people who clearly question that modality.
Okay, so one of the big things that we've been talking about, and you've seen throughout the news, all the way around social media, masks. And you've mentioned this, and I want to make sure that anybody who's just joining us now, you've been mentioning this for weeks, even though it seems like it's something new by the day. The idea of masks helping from a psychological standpoint is something that you've reinforced, and especially looking at the benefit of it from a psychological standpoint as opposed to anything concrete. But are we at a point now where there is any data, there is anything that we can look at via a study that says the impact maybe could be positive, or at least more positive than negative, with the cotton masks, right down to people just making them on their own?
So that's a very good question. Let's look at it from 2 points of view. One would be the scientific point of view in terms of measuring the virus spread, and the capability of these masks to actually sustain a barrier. And then let's look at it from another point of view, which may be the public health or even psychological impact. So scientifically speaking, The M95 and the N95, these are respirators. These are all, going from the very tightly fit mask with a filter, which is the M95, to respirators, which you see in movies where they have these two filters on the side. They look
Right.
pretty ugly and awesome. Those clearly have some effect in terms of biological warfare or contamination with bacteria or spores, and possibly some of the viruses. As you move below those high-end masks and filtration with a very tight fit, you go into now surgical masks, which don't have the same capability. As a matter of fact, within minutes, say 20 to 30 minutes, the moisture from your breathing probably creates a very weak barrier for that. But if you sneeze into them, the amount of spread is clearly going to be contained much more, or coughing, than if you did not have them on.
Even
Uh,
like a bandana, something like that. I mean,
well,
anything
I think
else.
that's your next level. The
Okay.
next level is having any kind of a barrier that is made out of cloth. And if a single cloth versus multiple layers of cloth, the multiple layer cloth again can retard some of the spread. For someone who is has a possible viruses, sneezes or coughs. But as far as protection from the outside, from a scientific point of view, there is little value in that. So overall, there is some positive benefit to wearing them. They're usually not cumbersome and not tight-fitting like the N95, so they're not as uncomfortable. And, if it adds less than 1% to the whole impact of social distancing and identifying those people, uh, you know, uh, I can't really argue with that. I think that relying that if you wear the mask, you never got infected, I think is probably not the right conclusion, but that if you're possibly infected, you can actually reduce the spread.
What about the theory? And I don't know how much of it now as we look back, because as you've been maintaining throughout these interviews, a lot of this is time. We need time. We need to accrue data. We need something we can look at. And that just doesn't happen overnight. But the idea that, again, so much of this has been politicized, the biggest or one of the biggest blunders from a preparation standpoint, preparedness standpoint, is that we did not start massive testing early.
And we still have an issue with massive testing. So what the massive testing helps you is to identify the denominator, a number of people who have been infected. And it gives you an idea in terms of where you're going. I think that, at this point, looking at what news we're getting from the tri-state area, which was clearly a hotspot, things have either leveled off, and I think we're starting to see sort of a silver lining. The problem, of course, is that we don't know if there's a second wave behind this, meaning how long does the immunity last? Remember that normally when you have the flu, you have to get a flu injection every year. So it's not something that you get an injection with a vaccine and you're good for life. So we don't really know where we stand with this particular virus in terms of the resurgence of the infection. But the again, I think that we are seeing results of the social distancing. Now, going back to your point, I think you have to make a decision. And I think the decision may have been coming late, but it's the right decision. And once I think you make the decision, you need to stick with it to see what results there are. If the results were negative, we're just getting one surge after the other, we need to have a plan B. And on the other hand, what we're seeing is that it is working, not as quickly as we wanted to, but it is working. And you're hearing people start talking about rekindling the economy and whatever. So I think we're starting that it took a toll, the social distancing, but at the same time, I think we're seeing the effect at this point.
Well, do you think that there's enough right now to even lead down the road of reopening things in the next month? Or are we still at a point where we can't predict a second surge or just the result of a couple of false negatives coming back and impacting the society that's reopened?
So I think that the reopening in terms of economic issues has to be very well coordinated. so that, again, keep in mind, if you open the schools and people are going to work, that's fine. But if you don't open the schools and you send people to work, and those who have children may have issues doing
Right.
this, everything has to be very well coordinated in terms of the economy moving on. From a medical point of view, I think that we are thinking in terms of the possibility of a second wave. So we're not basically dropping our guard at this point. Even though we may go along with opening of the economy, we have to keep in mind that we may have to prepare for a second wave. The second wave could be worse, could be better, or could be the same. We just don't have any idea. If we go back to the 1918 epidemic, again, there were multiple waves, and each one had a different level of casualties associated with that. So it's hard for us to, again, predict on this, but I think that we have to be wise and not just open all the gates and say, okay, it's over, because that would put an issue. Now, from a medical point of view, what we need to do is that there are clearly medical casualties from the epidemic and the pandemic. People who either had to be intubated for a long time and have some sequela now in terms of weakness, et cetera, and rehabilitation. Many who have, again, perished. As you know, the numbers are high. However, from a medical point of view, there are a lot of individuals who required hospital care who could not get it at this point because
Right.
hospitals were full. And those are generally people who have other comorbidities, and for them to come to the hospital and get infected would have meant the end anyway. So we may see a second wave in terms of other conditions that the medical community needs to manage.
Well,
Lastly, of course, is elective surgery. When do we start that? Meaning, when is the right time to do that? And there are multiple theories around that, but we're starting to think about these things, which is a great, I think it's a great tribute to what we've done.
all right, so that kind of feeds into the last question about herd immunity and something that you brought up, I believe it was 2 episodes ago, about whether or not it would work in theory. And one thing that we talked about was just not having it's something that could work, couldn't work. There's not enough data, not enough information out there. It's something that's not going away from a political standpoint, from a discussion standpoint. Is that something that you look back and think could have worked, or maybe reinforcing now due to time that's passed the idea that we should have done exactly what we did and not subject a lot of the young people to this virus?
So yeah, there are clearly thinkers who believe that we should have let the young just wallow and have a good time.
Are
And
these thinkers medical professionals? Do they have MDs after their names like you, or are they PhDs and academics?
they're both. But again, the academics who are not physicians, such as epidemiologists, clearly deal with large population illnesses, etc. So, there are people who clearly think that the young should have mingled, got infected, and got immune, while we kept the aged and those who are frail away from them. There are places where this is actually, and I think I mentioned in Scandinavia, where this is actually being adhered to, and we have to see again the results. It doesn't make what we've done wrong, nor does it make what they say right. These are two different approaches, if you will. The problem is that we don't know the behavior of the virus, and if the immunity is fleeting, then the herd immunity that we're all looking into may not prove to be as effective as we think. It doesn't mean they're wrong, because we really just don't know. So we can't take the chance on that. And as a large country, and we have a lot of social activities, whether it be sports, shopping, etc. We're always out and in crowds. So that, maybe in Sweden, that's not a major problem because of weather, maybe, or whatever the reasons are. So we're going to be looking back to see how things fared. There are some theories that California did have, since the virus has been in California since November of 2019, does that mean that people had a higher level of immunity? Well, that may be possible. I think that's something that we could do as a look back to see how effective it was once we learn the immune cycle of this particular virus. But you could say the same claim for New York. New York is millions of people living very close to each other, and yet they had the highest mortality, and the highest number of admissions in the state, this tri-state area. So again, we could quibble about any of these things, but the look back, or the Monday morning quarterbacking, even works in medicine. It's not just reserved to sports.